We absolutely feel that there's a quality of life issue dealing with this. And in the past, we would say it was okay to deal with a unilateral hearing loss, but now we don't feel that way. So I think people do feel isolated, and not as engaged socially. And emotionally, I think it has a psychological aspect that needs to be addressed. Well, some patients just do not want to go through surgery. So although insurance companies sometimes will pay, most of the time will pay for the surgical option, they just don't want a quote-unquote screw in their head. Or anything that, shows, especially male patients. Women that have hair may have went for it. So that was something they just felt was not going to really improve the quality of life, and they couldn't deal with it. From the non-invasive option, from the cross section, I think some patients just didn't want to wear two devices, having one in one ear and one from the other ear. And it was a different method of transmission. One is just traditional air conduction, and the other one was bone conduction, the surgical option. So I think SoundBites brings something new and innovative to the table now because they have a non-invasive bone conduction option. The pieces that make up SoundBite are a small piece, an in-the-mouth piece that goes on the teeth. It's like a retainer, very small piece that goes on the teeth. And then there's a little piece that goes behind the ear with a microphone that goes in the ear. And that's really all there is to it. It's quite simple. Well, the process for a SoundBite is very simple, actually. You come and you see your audiologist first, and they do all the testing, and then we make a referral to the dentist. You have to go to the dentist to make an impression and get the medical clearance that the teeth are okay, and then the impression goes to the company. It's fabricated, and the patient comes back to us for our fitting and our programming and our verification measures to make sure that the benefit is there, with the new device. I think the key opportunities for SoundBites patients that they haven't had before are the fact that they're able to actually walk down a street and have somebody talk to them on the ear that's not appropriate. Or, you'll hear any doctor of audiology that'll tell you the minute they turn it on, we'll go right to that other ear and we will whisper in that ear, and the patients will just start crying. Because for the first time in how many years, they're actually hearing on that side. And I think that's very important. I can certainly comment on the aesthetics of the product. Being in New York, all of our patients want everything invisible. And so, that's something that's very important to a lot of people. They just don't want something to show. So I think that overall SoundBite product is actually very nice in the sense that you don't see the piece that goes in the mouth. Okay, and the piece that goes behind the ear, is not that visible. But from aesthetic standpoint, a lot of the patients in the beginning were concerned, but once they hear again, they're just not as concerned anymore about the little things that they were concerned about initially. And that's the quality of life impact that this makes on those patients. So our patients are reporting that it's very easy to use. I mean, just the first 10 that were part of our pilot launch, immediately came in and wanted it right in their mouth. So they immediately grabbed it and put it in. They didn't even want too much guidance. And the patients put it in, they hear better. So it's just like, putting their glasses on in the morning. It's something that they just get used to doing, and they won't leave home without it. I tell patients, technology changes so rapidly today. And I think it's important if they've had bad experience that they really need to, think more openly and positively and try something. They have nothing to lose. I don't think they know what they're missing until they hear it again. And I think that's what's important. You just don't know what you're missing. And when you hear it again, then you say, wow. And walking through the streets of New York, it is a wow what our patients come back and tell us about. It's just a whole new world opened up for them.